Indeed, you're watching KBC Channel 1. This is Good Morning Kenya. My name is Mike, and it's Tuesday. And when it's Tuesday, you know, it's about Health Tuesday. And today we are looking at something very pertinent, and it's concerning about the stroke, the rising cases of strokes amongst the young generation in Kenya. Currently, stroke is becoming a problem, given that people as young as the age of 16 are getting strokes, and people that falls between age of 16 to around 45 to 55. So what is causing all this surge in strokes in a condition that was previously thought to be or to belong to older people? That is a conversation we're about to have here on Good Morning Kenya. And in studio, I'm joined by Dr. Jessica Mwikali, who is a doctor and general practitioner at hospital. Welcome to the program.
Thank you.
How are you doing?
Morning. I'm fine, thank you. How are you doing?
I'm doing fine. Let's talk about this issue now. You know, as low as the age of 16, that should be alarming.
Yes, it
What
should.
do you think is bringing about all this?
Okay, so stroke is a growing problem in our country. There's a recent study that was done by Kenyatta National Hospital and Moi Referral Hospital in 2015, where 691 people were followed up for 12 months. So out of 631 people, 6.3% were less than the age of 30 years old. 10.4% were from 30 years to 39 years, and 16.3% were 40 years and above. So that shows how stroke is something that's really affecting the younger population. Things such as diet, lifestyle, genetics, that's what's happening in this generation. So for example, there's modifiable and unmodifiable causes. So non-modifiable include things like genetics, if there's a family history, things like hypertension, diabetes, those are unmodifiable. Also, there's a high prevalence in men than women in Kenya, as we have seen. So modifiable things such as diet, diet high in fats, animal fats, unlike saturated fats, are actually worse. This leads to cholesterol, which can block the vessels, leading to the strokes, stress, lack of emotional support. Yes, things like this is why stroke is growing in our country, but in young people.
Yes.
Yeah.
There's also, before even proceed, what is stroke and the types of that are there of stroke?
Okay. So stroke is when blood does not reach to a particular part of the brain. So let's say there's a pipe, then the pipe is blocked. The water won't reach on the part after the blockage. So that's what a stroke is, like when the lights go off randomly. So if blood does not reach at a particular part of the brain will not get oxygen or any nutrients. So the part of that brain is going to die. When the part of that brain dies, the affected side is going to start showing now the signs and the symptoms, which we said there's a mnemonic called be fast. So first your eyes are going to start drooping, you're going to start having visual losses. If you are walking, you can fall, you lose your balance, things like that. Your arm starts getting heavy. So these are the signs and symptoms you should look out for before, so you can know you're having a stroke. So immediately you start seeing these signs. That's the first minute. The second minute, immediately go to the hospital. So when you're in the hospital, the first thing they do, it depends on the time that you have arrived at the hospital. So first 2 to 4 minutes, you're going to be given a medicine that's going to block the clot, depending on the type of stroke. So the types of stroke are hemorrhagic stroke and ischemic stroke. So ischemic stroke, there's going to be a clot or an embolus. So something is going to be blocking the pathway of blood. So when the pathway of blood is blocked, then blood will not reach the brain, leading to a stroke. The other type of stroke is the hemorrhagic stroke, which is less prevalent than the ischemic. So the hemorrhagic stroke is when, let's say, there's a weakness on the blood vessel, then the blood vessel bursts. Then there's going to be blood inside the brain. So those are the two types of strokes. So when you reach the hospital after seeing the signs and symptoms, you're going to do a CT scan. So the CT scan is going to tell, is it an ischemic stroke, is it a hemorrhagic stroke? Because they're treated differently. So after the CT scan, then you're going to start immediately. If it's ischemic, that means kuna clot. So you're going to be given medicine that's going to remove the clot. So these medicines are antiplase, things like that. That's before the first 4 minutes. After 4 minutes, you're going to be given things like aspirin or clopidogrel, which you're going to take your whole life. So this is something that it's a lifetime. You have to take the medication for your whole life after that. So for things like hemorrhagic stroke, that's when the vessel bursts. So there's going to be bleeding in the brain. So the management for this is going to be, you can open the skull, remove the blood, and uendelee hivyo. But yes, those are the 2 types of strokes and how they can be managed.
There was a recent study by the Stroke Association of Kenya that was conducted on Kenyatta National Hospital and also Moi Teaching and Referral Hospital, and they found that ischemic stroke stands at 56%.
Yes.
Why is it so prevalent as opposed to the other types of stroke?
Okay, so we've talked about ischemic stroke. Ischemic stroke is when there's going to be a blockage in the vessel preventing the blood to flow. This can either be caused by an embolus. So an embolus, let's say you have a clot on your leg, that clot can dislodge, go to the brain, block the vessel, blood will not flow, then you'll have a stroke. So this is DVT. So what causes DVT? Things like oral contraceptives, smoking, things that prevent your blood from moving freely. So it causes your blood to clot. So things like that. Also cholesterol, high cholesterol foods. This is going to cause like a cholesterol ifunge the vessel. So the cholesterol is going to form a cover or like a blockage in the vessel, and it's going to prevent the blood from flowing properly. So this is going to lead to a stroke. So those are the ischemic causes.
Yes.
So it can be an embolus or a cholesterol blockage. Yes. What we call atherosclerosis.
Okay.
Yes.
Between the time that you have recognized the symptoms and treatment, is there chances that stroke can be fatal?
Yes, there are chances where stroke can be fatal when, let's say, because we have said the first 2 minutes are very vital. First minute you recognize the symptoms. Second minute you go to the hospital where a CT will be done. Before the 4th minute you're going to give them medications to break down the clots. If this does not happen, if you take so much time and aspirin and clopidogrel don't work, this can actually lead to death. And even, let's say, a cause like, let's say, a motorbike accident. A motorbike accident can lead to the vessel tearing. This can lead to a hemorrhagic stroke, which can then lead to death. Also, by the blood loss that has been lost, can also lead to hypovolemic shock, then death. So there are very many different ways you can die from a stroke, but also there are very many different ways you can sit, go to the doctor, get help. Yes.
So time is paramount when it comes to
very paramount.
Stroke.
Yes, you should be fast.
And, what are the other risk factors that are there? What about age in terms of you have a stroke, but then again, are you prone to getting better, or it's going to be a lifelong condition?
Okay, so we're focusing on the younger people with stroke. So yes, younger people get stroke a lot, but also younger people have more strength and more resilience than older people. So after a stroke in a young person, if they don't have serious comorbidities, they can easily recover, especially if they go to the hospital, they see the symptoms very faster, they go to the hospital, they get help. Then after discharge, they can get some kind of help, like from hospital, where some nurses can come, ICU nurses, any doctor that you need in the house. So when you have proper care in the house after the acute incident, that will really help with the recovery. So let's say you're supposed to take like a month to get well. If you have proper hospital in your house, proper care, you're going to have like 6 weeks or less to get better. Yes.
When it comes to information about stroke, especially amongst the youth.
Yeah.
Do you think there is enough information regarding strokes and its early signs?
Actually, I don't think there's enough information about stroke for the youths at this point because first, the highest cause of stroke amongst the youth is hypertension. People, this age, our group age, we feel like hypertension is something for the older people. We don't know that hypertension actually affects a lot of people younger than 30, so we don't check. Then when we don't check, it can lead to clots and it can lead to weak vessels leading to strokes and all that. So I feel like more talk should be had on stroke and more talk should be had on hypertension and how to control some side effects, and also how to protect yourself, like on boda accidents, because those are also the highest causes of stroke amongst young people. So hypertension, boda accidents, diabetes, so those are up there causing stroke in younger people. So those are things that we should talk about more often to create more awareness.
Is stroke something that you can go to the doctor for a normal checkup and be screened for?
No, you can be screened for the comorbidity, the things that can lead to stroke. So things that can lead to stroke, we said they can be modifiable or non-modifiable. Yeah. So the modifiable causes, such as your diet, oral contraceptives, which cause clotting, smoking, drinking, those things can lead to increased risk of stroke. So when you go tell your practitioner that, they usually weigh out how in risk you are to get a stroke. So now the unmodifiable causes, such as genetics, let's say you have a connective tissue disease. So these people with such diseases, their vessels can get weak, they can form bubbles which burst, leading to a stroke. So your doctors know such things, yeah, in case it's unmodifiable.
Yes.
Yes.
How would you say, or what would you say are the challenges when it comes to managing stroke now, especially in a hospital setting?
Okay. So you see, for the management of stroke, let's say you have already seen all the symptoms, you've gone to the hospital, let's say you've gone to a hospital less than level 4. So in a level 2 or level 3, you might not find a CT scan. So if you don't have a CT scan, they can just do first aid, then they refer you. So you see that time between referral and getting help in an acute situation, that might take time for the patient to properly, fully recover. So yeah, the first thing you should do when you have something like that, you just go to a level 4 hospital or a facility where there's a CT scan, where they can immediately take the scan, see whether it is ischemic or hemorrhagic, and start the management as soon as possible.
Yes. Let's picture a scenario. Signs have been there, a patient has gotten those signs. What happens at the emergency level, the first aid type of a response? So
for us, you just start with the ABCs. The airway, you check whether the airway is patent. Breathing, you check whether the breathing is okay. Circulation, you check whether if they're bleeding or anything, because we know also a lot of bleeding can cause a stroke, because when you're bleeding too much, blood cannot reach the brain at some point. So if there's bleeding, you stop the bleeding, you control it. Then you can give, if it's fast before 4 minutes have passed, then you give that drug that I told you called Altiplase. That's only given for the first 4 minutes. Then after that, then you can go to the secondary survey. But yeah, that's basically the first aid for when a patient comes in with stroke.
What if it's a case where access to a hospital is somewhat of a challenge?
So there's some people who usually get the feeling of something bad is about to happen. We call it feeling of impending doom. So those kind of people are usually told to just start taking aspirin. So when you feel like you're far and you're feeling a feeling of impending doom, you just chew on an aspirin slowly, or place an aspirin under your tongue, or just take an aspirin. Yeah. Otherwise, so as you're taking that aspirin, you make your way to the hospital immediately.
Yeah.
Yes.
From your own experience and working as a doctor and general practitioner, do you think our healthcare system is prepared enough to handle, now that these cases are rising amongst the young generation?
Yes, I think the health system is ready for this kind of courses because this is what we learn in school. It's the theory and the practical match. So I think they're very prepared. It's something that's very basic when you're in medical school. So yeah.
There are misconceptions about stroke. I don't know how true this is. Like when you get into a shower, you've woken up, gotten into a cold shower, maybe that would be a cause for a stroke. I don't know how the science, if it's true, or the science that works around that. Amongst that, what are other misconceptions? As you explained that, what are other misconceptions about stroke?
About stroke. Okay, the big one is that it happens to older people only. That's the main one, and that's the one that should be tackled seriously. Other misconceptions about stroke is that people don't fully recover. If you have a good, after the hospital, if you have good aftercare hospital, like hospital, after being discharged, you need to go home, you need to have proper care, like ICU nurses, proper doctors to come. It has to be a multidisciplinary approach to help people after the attack, after the acute attack. So you can fully recover if you have a proper approach towards it. But yeah, some people think after stroke you don't fully recover, and that's not the case.
But then again, it also points out to access to these services, which requires money.
Yeah.
Do you think the aspect of procuring doctors or specialists and nurses, as you have put it, is gaining traction in Kenya in any way? In terms of getting once you are discharged, do you think it's getting prevalent that people can access this care given the kind of cost that comes with it?
Well, it depends on the type of facility that you're going to consider after your hospital care. So for example, I work with hospital, and hospital is a very affordable facility. It provides ICU nurses, the psychologists, psychiatrists, the physiotherapists, depending on your needs. And also the people are professionally trained, so it's not such a burden, and also it's very affordable for the common mananchi. You see, for example, if you've been discharged after the ICU, you have a stoma or you have a tracheostomy to help you feed because you can't swallow, because sometimes patients who have just gotten a stroke and they have been discharged from the hospital, they can't feed immediately, so they have to feed through a pipe. So it's hard for you as a caregiver who does not have a lot of medical knowledge to do these things. Also, you must be busy doing other things, and let's say your family member is there. So it's better to consider things like hospital, trained professionals that will prevent even bigger problems from happening, because they are trained, so they know what to do.
I want you to paint us a picture of there's a person who has been discharged. What is that, and even if they are not able to afford all this, what is the care, what does it look like? How are they taken care of by the people who are giving them attention?
Okay, so let's say a patient has just started having, we can start now from the beginning, from them having a stroke.
Yes.
So this is a patient who, let's say, has hypertension. Let's say it's a 32-year-old who doesn't know that they have hypertension because we don't screen ourselves. So they're on the toilet, then they start feeling like their hand starts getting heavy, their face starts drooping, and thank God they know the signs of a stroke early. So immediately they go to the hospital, the first 2 minutes. So in the hospital, they do the first aid, they give them Alteplase, then they give them the drugs to go home with. But then the stroke kind of affected their feeding. So they had to put a stoma and for them to continue feeding as they're healing. So the person gets discharged. But the person just lives with the sister who works, who does not have any medical care experience. So what will happen? What will happen is they will call hospital. Hospital is going to send a caregiver depending on the stage of recovery. So let's say that immediately from the ICU, hospital will give an ICU nurse. Or let's say if they're doing better, they just need to be helped with daily activities like eating, cleaning themselves, then we can just send a CNA, a nurse aid. So yes, it depends on how much they'll need support. So yes, after that, the nurse aide is going to support the patient, is going to feed them, make sure the stomachs are clean, make sure they are well fed, make sure they're given their medications on time, because you know after they're discharged, they're given medications for life. Yes.
Let's look at how this can be prevented. What needs to be done at personal level to ensure that cases of stroke at least are mitigated or prevented?
Okay, so for primary prevention of stroke, firstly, people need to be told education. Education is the first thing, to know the signs and symptoms, to know how to get help, where to get help, and what to do in a situation. Also to know that the prevalence of it, it's not only the old people getting it, it's also the young people who are getting this thing. So education is very important in such a thing. So the next thing is your diet.
Before we consider, should it be included in like some sort of within curriculum?
Yes.
To make sure that people at least know from a young age?
I think it should be included. Maybe in high school when you're starting, I'm not sure where, but yes, I think it's a very important thing to be included. Not only check your parents for pressure. When you're checking for your parents' pressure, also check for your own. Yes, when you're screening, when you're going to the hospital, take your parents for routine screening, take yourself also. It's very important. Yes.
Why should screenings be made like accessible and something that people consider so that we can end this?
Yeah, so screening is a very important part of primary prevention of any disease, not only stroke, but everything. So when you do screening, let's say yearly, 2 yearly, 3 yearly, you're going to prevent a lot of costs in the future, honestly, because you're going to stop the thing before it proceeds or before it causes any more damage to yourself. Yes, financially, physically, in everyhow.
There's also the aspect of mental
health.
The aspect of mental state when it comes to stroke.
Yes.
How should one, or because it does not only affect the patient, it affects the people around them. How should that be approached?
Okay, so for mental health, I'm glad this generation is very into mental health. They actually like going to get help when they feel like they are getting depressed or anything like that is happening. That's a good thing. But mental health is very key in getting stroke, because first, if you're in a situation or you're in an environment where you feel like you can't talk to anyone first, you won't even be comfortable to say if you're feeling bad, ama if there's something going on with you. Secondly, if you're in an environment that's not satisfactory or that's not good for you, it's going to lead to a lot of cortisol production in the body. And this cortisol production can lead to clots. And this can lead to stroke also. So yes, so cortisol is a stress hormone. So stress, cortisol, stroke, it can happen. It's not very common, but it is possible.
Yes.
Yes.
What about the cholesterol? It's also a contributant of stroke.
Yes, so cholesterol is the bad fat of the body. So people usually go look at their cholesterol, mostly men over the age of 30, but this cholesterol can also be hereditary. So let's say your father died, or let's say your father has cholesterol problems, your grandfather has cholesterol problems, you should start screening immediately, because cholesterol is a killer. So let's say when you have high cholesterol, the cholesterol is going to start closing the arteries. It's going to start filling it up, preventing the blood from flowing normally. So this can lead to so many things, not only stroke, but also a heart attack. So cholesterol is a big killer, silent killer, actually.
Is it true that eggs contribute to the rise of cholesterol? Boiled or?
All of them. Actually, they say that the most cholesterol is in the egg yolk.
So it's true that it does contribute.
It does, yes.
Also, the aspect, sedentary habits of human beings, of just sitting around. That
sitting around, eating junk food, like we like eating KFC, chicken in, things like that. Okay, it's not bad to eat them once in a while, but these things are full of cholesterol.
Of course, we have cheat days. You know,
we have cheat days.
We have cheat
That's
days.
very okay, but we should be careful with the diet. Also, yes.
So, so diet is one of the things that people need to, because I don't think really people really pay attention to diet and relate it to stroke. And I think that could be one of the reasons that there is a rise in these cases. Yes.
So diet, when you take a lot of unprocessed foods, when you take a lot of deep fried foods, these foods have a lot of cholesterol. They form plaques. They form blockages in the vessels, so the blood doesn't go well. Yeah. So these things lead to, and then when you eat like that, and then you don't exercise or you don't keep moving, when your intake is more than your outtake, then there's a problem. Yes.
As we close, stress on the importance of getting professional rehabilitation, especially when it comes to cases of stroke, whether you are young or you are old.
Yes. Okay, so after hospital.
Either before and after.
So rehabilitation for people with strokes, the best thing to do is after you've come out from the hospital, it doesn't matter what stage you are in. If you have the facility, if you have the capabilities, get a nurse, get a doctor, get someone who is medically trained, and that will really help the chances of recovery. Yes, and it will increase the, like, how fast the patient is going to recover.
And this includes the physiotherapy aspect of it?
Yes, physiotherapy, counseling, because you know these kind of things, they also cause trauma, kind of. When you go through something very traumatizing, like let's say you've had a motorbike accident, and then you developed a stroke after that, and then you've been taken to the ICU. Let's say you've stayed there 7 days. Now you're coming out. That's a lot of psychological, you know. Yeah. So you need a lot of people, multidisciplinary team, and hospital offers all this. And that's the best thing, because you don't want to be going to different facilities for different things. It's better to just approach one person, tell them this and this and this, then they provide the ICU nurse. When they recover better, they provide nurse care. When they get better, they can get a psychologist. Yeah.
Nice. Daktari, your final words.
Okay, so thank you so much for having me on the show. I'm very happy to be talking about an important topic about stroke in young people, which is very prevalent in our country currently. And I'm also thankful to hospital, which I am speaking on behalf of today. In case of any emergencies, you need someone to be there with your loved one after a stroke. A hospital is the place to be. So I'd like to give them my number. Okay, so hospital, the number is 0713 749001. That's hospital.
Indeed. Thank you so much for making time to come and shed light on this issue when it comes to stroke, especially now that the younger generation is facing this, what you'd call a crisis.
It's a crisis.
Yes, and that to look out for in terms of identifying symptoms and steps to take. This is where we end this conversation. That has been Dr. Jessica Mwikali, who is a doctor and general practitioner at hospital. This conversation ends now.